No, hold it up this way.
It's got to be in front of your
It has
mouth.
to face your mouth.
Okay, good.
No,
Ice cream
no.
cone,
Dave,
like an ice cream
David,
cone.
Have to point
Okay,
toward your
like
mouth.
that?
No,
or point
tilt it back to you 45 degrees.
That way.
Okay,
That
okay.
way. There you go.
Okay, we got that straight. I don't want to be too loud, as I said. Jim asked me to speak about this topic, and he said, from an insider's view. I'm a physician, and so I think I have a lot of inside information regarding this topic, so I was glad to do so. But he said, try and do it in a few minutes. And I said, wait a second, Jim. I said, this topic's going to take longer than a few minutes. Indeed, if it spills over into next week, it could, because I don't want to drag this on too long, because I could talk for hours and hours about many of the things I'm going to mention here. A couple of things I want to mention before I get started is that the things that I'm going to present, some of them have been there a long time, so that they're not new things. Some of them started long before 1950, but many of them have come about in the last few years, particularly with the pandemic, etc., and various other things. But the thing I've noted is that all of them seem to be increasing in frequency. And we're going to experience many of these things. I think you're going to, whether it's the news media or whatever, you will see these things with increasing frequency and may have already seen them. And the last thing before I get started, I want to say, whatever you do, my biggest advice to you is stay informed. Don't necessarily believe what I'm saying. Don't believe what you're reading in the media. The best thing is to educate yourself, because as you know, we all know about misinformation that's out there. And you can call it fake news, however you want to term it, but there's a lot of stuff like that running around, whether it's on the internet, whether it's on in the media, it's there. So be aware of that. The thing that I enjoyed most in medicine was when a patient came in and was informed, so that they knew about this condition, and they had educated themselves, for example, and would ask me questions about it. That was the most gratifying thing for me in my many years of practice. So with no further words, I will get on to the next slide, which is this, depopulation. So you talk about medical practice and depopulation. Those two words don't seem to go together. In medicine, you think about doctors are going to make you better. Medicine is going to make you better. And then how does that fit with depopulation? Well, you're going to see by a number of things that I show you that indeed there may be some involvement, maybe more than you initially think about. But, I'm going to present this not to sound conspiratorial, but just present the facts as I've seen them in medicine. That first thing on this, under the title of this, is primum nocere. That's a Latin phrase, and it's something that, is when I graduated from medical school, the medical students at that time attested to this, so that they believed. It means, in English, it means first do no harm. Primum nocere, Latin phrase. It came from the writings of Hippocrates, which was back in 440 BC. And Hippocrates talked about the role of a physician. The role of a physician was not to do harm to patients, but to help them do what was best for patients. Always was the role. And he even had something in those days to say about a physician's role or not being involved in abortion. So as one of the topics next, or one we'll be talking about, I'll show you what I mean. Okay, this is a summary of the topics that I'm going to discuss today. Some of them I have a lot to say about, but some I may have to cut short a bit. But these are avenues, I'll call them avenues, or things in medicine that have come about which may be leading to depopulation. And whether it's practices that are done, whether it's practices that are encouraged, etc., all of them can lead to depopulation. And I'll go through these one by one, but everything starting from physician-assisted suicide. I have quite a bit to say about that. Abortion, money in the role of big pharma in medicine. Some of you may not understand what big pharma means and how it influences medical practice, but I assure you that it does. Here's the next topic being transgender. Transgenderism, whether it's be surgery or hormone blockers, is definitely prevalent in our, becoming more prevalent in our society, and we'll describe that. COVID-19 vaccine, the role of fear in medicine. When I talk about fear, I'm going to talk about physician fear and why they do the things they do. De-emphasis of God and nature in medical practice. Just mention briefly, remember that Luke, our disciple Luke, was a physician by profession. Somebody was mentioning to me that most of the disciples were fishermen. Certainly a lot of them were, but Luke was one who was a physician by trade. Last topic I will mention is addiction, and that is, how did the physicians play a role in addiction, which is definitely a problem in our society today, and how this leads to depopulation. Okay, the next slide, being physician-assisted suicide. If you see that picture there, that's a pretty illustrative picture, and what it's showing you is the practice of active euthanasia. That is a physician actually administering a drug that's going to end somebody's life. Now, he can do this by actual injection himself. He can do this by prescribing a medication for somebody so that they end up passing on with this. It's obviously the easy way out. The way it's being presented in society and in medical literature is that this is kind of accepted. It's a good thing. It's trendy to do this. They don't talk about the moral implications of it. They don't talk about, what happens to families, etc., because of this. But physicians definitely play a role in it. Let's talk about how this got started. Well, it became legal by some means in the Netherlands in the early 2000s. And I think we all remember all of us in Michigan especially would remember a famous doctor called Jack Kevorkian. Jack Kevorkian was born in Michigan, passed away in Michigan, and most coincidentally, he was a prisoner here at the Coldwater Federal Correction Institute, right here in Coldwater for a number of years. But, so when he practiced his euthanasia that he had been found guilty of, it was against the law in the United States. However, since that time, as Jim was alluding to about the West Coast and the East Coast, it's now become legal in certain areas. Some states have made physician-assisted suicide, active euthanasia, a legal practice. It seems to me that's taking, the role of God. But one of the things that may surprise you, I know it surprised me, that when I was doing some research about this, that you would think, okay, physician-assisted suicide, they're doing this because patients are in terminal pain. That is, they're dying from cancer, they can't take the pain anymore. So many people would think that. However, that's only about 20% of physician-assisted suicide cases. 80% are due because of social reasons. For example, a patient feels isolated and they're all alone. And so let's just end it all for him now. Maybe there's psychiatric reasons behind it. For example, which couples with being alone, he or she may be extremely depressed, can't function well, so let's end his life. And so, again, this seems to be a step that really doesn't fit with the art of medicine and making people better. Okay. If anybody wants to interrupt me as I go, please do so with questions. Okay, abortion. We know that abortion is been going on for a long time, but as I stated earlier, in the Hippocratic oath that physicians take, it says that physicians should not be involved in abortions. Now, we know in the United States, for example, that the physicians are the ones who perform abortions. They perform the physical or the medical type of, or physical type of abortion, so that they do the, whatever it is, the procedure. And if you've seen the movie, either Roe versus Wade or Unplanned, both of those movies illustrate this procedure pretty well. And if you've seen it, I mean, it's a pretty devastating thing. Physicians can also do it by chemical means. That is, they give hormones. They give the abortion pill. You've heard of this, perhaps, the number RU486. That was a term for this particular medication that you prescribed to women that would cause an abortion. And so, again, physicians playing a role in that. The things that it almost is presented in medicine and in the literature and the media that this is the right of a woman to do, that this is a key part of a key part of health for a female, a key part of reproductive health. So you can dispute that one, but when physicians do it, they can, and somebody comes in and saying, well, doctor, I'm thinking about aborting. I'm thinking. And frequently, physicians won't go into this discussion of not only the moral implications, because they think, well, this isn't my role to discuss whether this is right or wrong, but they will, not even talk about what the long-term effects of this will be. That is, how it affects a woman, perhaps a man, but primarily a woman, years later. My wife Mindy is a therapist who sees clients frequently, and you'd be surprised at a number that come in, older women who have, suffered a abortion, or had an abortion so many years ago, how it's impacted their life. It's incredible, and it really does. It's a big deal for a woman. Okay, I will go on to the next topic, which is financial money. How does money play a role in all this in depopulation? Well, I can tell you this, and you may have heard this because of discussion in the media somewhat about reimbursements. What are reimbursements? Reimbursements are what a physician can get, or a hospital system or a hospital can get if certain things are done. For example, so if you make all your patients or insist all your patients get a COVID vaccine, that may be considered what the medical system or the insurance company requires. They want you, they've come up with requirements that a certain number of your patients have to have this done in order for you to reach your goals. And, so money plays a big role in what the big pharma, and I talk about that in a later slide, but what big pharma, how their contributions to medicine are many times based on what a hospital or hospital system has done. Some people have this opinion about now doctors are just legal drug dealers. That's horrible, but in some cases that may be the case. At some doctors, that's the way it is. You go in there, they prescribe a drug. Okay. Let's talk about big pharma. What is big pharma? Big pharma is a term that's been used for the grouping of major pharmaceutical companies worldwide. And you've heard the names, and you see the names of certain companies all the time on TV ads. For example, Pfizer. For example, AstraZeneca. And others. I'm not going to get into them, but those are grouped as big pharma. How do they play a role in medicine? Well, the fact is that role of big pharma goes back way into the early 1900s. And it started with J.D. Rockefeller. And I don't want to bore you with some of the details, but early on, when he found that what were called petrochemicals, so from oil refining, there was something that was produced called petrochemicals. Petrochemicals basically developed into the pharmaceutical industry. Started out as vitamins, they used them to make vitamins, then they start making drugs from them. And big pharma then started making contributions. How do we get the physicians to use these drugs? How do we get them? We start contributing not only to medical schools, medical education, so that doctors learn that these are the drugs in medical school, what they need to prescribe. Started, and it continues throughout the physician's career. For example, in continuing medical education, you may have heard of that. Those are courses that doctors have to take to further, whether it's continue their license or whatever. Those are sponsored oftentimes by big pharma. Now, it doesn't take much to think about how this influences a physician. He sees this drug all the time, and he hears about it from the pharmaceutical representatives that are involved with the continuing medical education course. But first of all, he hears it in medical school. This is what you need to do for this, and it's you can see what happens with big pharma. Not only that, big pharmaceutical companies, they contribute to medical schools. But if you look at the funding of the FDA, and look at the funding, and I'm telling you that a large part of the funding of FDA comes from big pharma. So you can follow the dots there, what that's going to do. Big pharma also funds research doctors. So somebody wants to do a study, then big pharma it takes money to do any kind of research study. Big pharma may back that study, of course, with the understanding that the results of it are going to help them in some way. And when I talked about continuing medical education, and I'll touch upon addiction in a bit, but medical education courses are major things. So, for example, one of the approved medical education courses was about chronic pain management. Chronic pain management, and this was a national course. What do you think one of the things they emphasized for proper chronic pain management? It was pharmaceuticals, it was drugs. It was OxyContin, it was, codeine, it was whatever. And so, as a result, I know the drug crisis has become widespread, a lot of it because of the drugs that are coming in from other countries. However, we were doing our own self-damage and to our population by prescribing these narcotics, which were Big Pharma was influencing, and it wasn't a good thing. People that have been addicted, people with chronic pain that are addicted to pharmaceuticals are in bad shape. In bad shape. I feel sorry for them because many of them were victims of what they were prescribed. They didn't intend to do this. They weren't addicts by nature, but they weren't taking it to get high. On the other hand, they took it, and as a result, they became addicted. Maybe the addiction led to an early death. Okay. I'm going to say some words about transgender things. Maybe this will be offensive to some people, I don't know that. But I'm going to tell you the facts that I see in medicine regarding transgender and what I've seen about education regarding this topic. First of all, transgender surgery. What is this? Transgender surgery, okay, somebody feels, let's take a woman, a natural born female, believes that she isn't a female, that perhaps she is a male. So what happens if she goes to her doctor and her parents approve this, or let's say she's well, first of all, let's start with an adult. So she goes to her doctor and says, okay, I want to be a male. So how do I do this? So the first thing is transgender surgery. Transgender surgery, in the biggest procedure done in that case is having the breast removed. So this was a natural born female. She was born with breast tissue. First thing, take off her breast. So she has the chest of a male. Second, but a part of that breast surgery, especially in somebody older, is they have to reconstruct the entire chest wall. So if you've read about somebody who's undergone this surgery, it is actually pretty horrible. It's extensive, it's not an easy thing. Not that a mastectomy or taking somebody's breast off is easy by any stretch, but this goes far beyond taking somebody's breast off. This is taking their chest wall, reshaping it so that it's more like a male. Second procedure, facial reconstruction. So you take somebody, it's a female's face, and you say, okay, well, I want to look more like, I want to look more like a male. So what they have to do, perhaps reshape the jaw. It can be pretty extensive. Reshape the nose, lots of possibilities. And the other part of that is, and the most devastating part is genital surgery. You think transgender surgery, that's usually the last thing done, and that is they may remove a female genital, may take her uterus off. In a male, if a male felt that he wanted to be a female, or felt that he belonged to be a female, then they may remove his testes. So it's a pretty devastating thing, and there's a lifelong complication with that, in that you can't reverse those things. You do not reverse a hysterectomy. You do not reverse somebody who's lost their testicles. That is impossible. So, it's one thing when adults experience this, or adults go to the, to physicians and say this. Many of us would feel, okay, they have the right to do this. They've made up their mind. They're adult. They can convert to the choice of it's their choice. However, when you see what's going on in pediatrics, and even in some major medical systems, such as I just saw yesterday in one bulletin I get about Vanderbilt in Tennessee. Vanderbilt in Tennessee is now in their children's hospital. They're kind of pushing transgender surgery for kids who come in and say, oh, I think I want to be a different sex. They're kind of pushing it, and it's not just Vanderbilt. It's at Boston Children's Hospital. It's even sad for me to say, I'm from Pittsburgh, and even in Pittsburgh Medical Center, they're pushing transgender surgery, and it's been done as early as age 6. So hold on to your hats with age 6. So somebody 6, and you might say, well, isn't this their parents? Yeah, of course, the parents. So some parents, because of, for whatever reasons, actually encourage the child. Oh, we go to, Johnny says he wants to be, or Sally says she wants to be a male, whatever. Parents do this. They're definitely involvement of parents. However, embarrassingly, the medical community is also involved in this. So I recently read a case where a young lady was feeling that and she was 13 at the time, she was feeling that she wanted to be, she didn't belong as a female, she wanted to be a male. She said this to her parents kind of jumped on this right away, and instead of dissuading her, which many of us might do, or talking with, they said, okay, this sounds like a good idea, let's get a medical opinion. So they went to the first endocrinologist. That would be the natural doctor saying, well, what can we do here? Well, the first endocrinologist said, no, you're too young to make that decision at age 13. So what did the parents do? They then took her to 2 other endocrinologists. 2 other. Both of them say, oh yes, this is a good idea, we should proceed with this. And this young lady did proceed with it, and she had the surgery, she had hormone blockers, and sad to say that then at age 17, 18, she realized, oh, I made a mistake. This isn't, this was not the right decision. She realized that many years later, well, guess what? You can't change it at that point. And there's just very little to change. You can't, and even if they had, let's say that they gave her, breast tissue or did something to, what's happened with her, she'd never be able to breastfeed again, because when they did the surgery, they disrupted her breastfeeding mechanism. So it's all done. So that surgery is permanent. So imagine you're 18 years old and you realize, oh, I made a mistake. And that's happening more than you know. The other thing is, in schools, as reading the papers or whatever you read, you see that this is actually being seen, oh yeah, this is a normal thing. This is normal. It's not, you understand, oh, I want to be a transgender. You're starting to order, if not way exceeding what God has chosen for us, in my opinion. Okay, the other thing about this transgender surgery, and you may not realize this, is that now insurance companies are reimbursing this, believe it or not. So you wonder why, medical insurance costs are so high. They're reimbursing this transgender surgery. In addition, and I did look at this on the website. Here's the CDC. This is our supposed respected federal agency, Center for Disease Control. There's something on their website that it's for teens and young adults, who are considering transgender surgery. And they go through the full thing, they encourage it. There's no doubt in my mind, after looking at this is an encouragement of transgender surgery. So that's pretty big, because as Jim mentioned in his talk, somebody who has had transgender surgery or hormone blockers can't reverse this, and they're permanently sterile. So you're talking about a young lady who now can't have children, even if she so chooses. Okay, COVID vaccine. Now I know this probably is going to be a controversial topic, but I will just tell you a few facts about it because, first of all, what amazed me, this was never a vaccine, not truly a vaccine. So vaccines, many of us had vaccines as children. We had smallpox vaccine, that was a big one in smallpox. And, those were things, and polio. Almost all of us got polio, both of those vaccines. But a vaccine at that time was something to prevent a disease from occurring. So if you got the polio vaccine, you weren't going to get polio. If you got the smallpox vaccine, and the other thing about these were deadly diseases. These were not, something that you're going to be sick a while and, then recover. So these were deadly diseases, so they were trying to prevent a disease, and that was a vaccine at that point. It was something to prevent the disease. So what happens with COVID, called vaccine? It really didn't fit the definition of a vaccine. The official definition is it prevents a disease. All of us know that COVID vaccine does not prevent a disease. There's no way it prevents it. And so what the CDC decided, okay, we're going to change the definition of vaccine. 2021, that's just a little over a year ago, they changed the definition of vaccine. It doesn't have to be something that prevents a disease. It's something that helps fight the disease. That's basically what the definition of vaccine has changed to, because the COVID didn't fit a vaccine. The other thing I will say is that coronavirus was never a deadly disease in most people. Now, I'm going to modify that because it was deadly in high-risk groups, older adults, infants that, there were, or children, young people who had immunocompromised. Maybe they had a bad disease that, compromised their ability to fight diseases. But the fact is that it was not a fatal disease in the vast majority of people. Therefore, why did they push a vaccine that wasn't for illness? Or why did they push a drug, I'm going to call it, not a vaccine? Why did they push a drug for something that was not fatal? Why do young, healthy adults that don't have immune issues, that are normal adults, why do they need a vaccine such as this? And part of this also is the forgetting the adverse effects of the vaccine. So you go to your physician, and many, they say, oh, you got to get your vaccine. This is your time to get the vaccine. You need a booster of your vaccine, get it. You better get it. Well, the facts are that nobody talks about, well, what are the complications of this? What are the adverse effects? And you see that acronym, VAERS. That stands for Vaccine Adverse Effects Reporting System. So it's a fancy term. And initially, when that vaccine came out, there were a lot of bad reactions to it. Did you read about them? No. Did you hear about them? Almost never. The media never covered the adverse effects, but there were effects known. And so they developed this vaccine reporting system. Problem with that is this, that only about 10% of the bad effects of the vaccine have been reported. 10%. 90% of unreported, or just not reported in that VAERS data. So I place very little credence in the VAERS data. The other thing about the VAERS data that you may not know is that, let's say somebody dies after receiving a vaccine, which has definitely happened. Without a doubt, it has happened. I'm not saying this to scare you, but it has happened. If it happens within 3 weeks of the time they got the COVID vaccine, then they will accept that as data to the VAERS system. They'll put it in their system, this person died. However, if it happens after 3 weeks, so in general, an older person got the vaccine, in a month or 2 or 3 months later, he gets sick, unexplained illness, never attributed, and dies, and it's never attributed to the VAERS, or it's never attributed to the vaccine. The next slide, I believe, shows the some of the things about the vaccine. There's messenger RNA in that. What is messenger RNA? You may have heard that term. This is the first vaccine in medical history that has had messenger RNA, mRNA. RNA is one of the building blocks of the body. DNA, RNA, one of the building blocks. And what this messenger RNA, it's in this vaccine, it was supposedly put in there to energize the vaccine, make it more effective. But what it doesn't tell you is that that messenger RNA stays in the body a long time after you've got the vaccine. So you have messenger RNA, you have it in your body, and it's been attributed to a lot of the problems with the vaccine. I'll give you an example. And I saw this as on a video that I watched from Boston Children's Hospital. I believe, well, it may have been New York Children's Hospital, but it was definitely a video made. And they said, oh, now this, the children that get this vaccine may get myocarditis. Myocarditis is an inflammation of your heart. Trust me, it's not something you want. I don't want it. Nobody would want that. However, this has been shown to be an effect of the vaccine, especially in the pediatric population. What this cartoon was showing is that they showed a character got the vaccine and she got myocarditis. But she goes and she gives the whole story. Oh, my heart got swollen. The doctor said I had myocarditis. Like this is a normal thing. Trust me, it isn't normal for a kid to get myocarditis at all. In my whole career, 41 years, I never saw a case of pediatric myocarditis. Now all of a sudden it's being reported a lot. And so they make it a child think, oh, this is a normal thing. That's myocarditis, that's no big deal. And the child in the video says, oh, I went to the hospital and they gave me medication to help it and I'm fine. This is not the medicine that I know or medicine that I grew up on. This is a vaccine that probably doesn't belong, certainly in the pediatric population. Going on to the role of fear. I talked about this in my introduction, just fear. How does this fit in to your doctors and the things that they're doing? Let me tell you this. On the first slide, I had a term that said dichotomy in medical practice. So I'll just step back a little bit. Dichotomy meaning that there are a group of physicians, very noted physicians, people that have been famous in their own right. I'll mention people like just one, Judy Miskovitz and forget her first name, Peggy Tenpenny. These are noted physicians. What's happened, because they were punished, they weren't following the party line, so that they weren't doing what the hospitals were telling them. Hospital systems were telling them. They weren't doing what their medical organizations were telling them. So these people were punished as if that they were some weird doctors. These were not weird doctors. Trust me, the doctors that were, many of the doctors that have thought that, for example, they didn't follow the party line. They believed in things like ivermectin for treatment of COVID. They didn't believe in the vaccine, but because they didn't follow that party line, they were punished. And punishment can be many things. It can be a financial punishment. That is that they take away your reimbursements, your ability to collect money. Worse, they take away your hospital privileges. So all of a sudden, you're a doctor, you've been with the hospital for years, because you're not following their prescribed treatment, you're not following the protocol, you're out. You are not allowed to admit patients to that hospital. Or, going a step further, which some of them experienced, is a loss of license. Loss of hospital privilege is one thing, but they took away their license. These are physicians, very qualified physicians. They took away their license because they were not preaching or practice. They were practicing different than what I will refer to as the party line. That is, you got to treat COVID this way. You got to treat COVID. You got to give vaccines. They didn't believe in that. They get castigated, taken apart, and then lawsuits. So of course, I don't know if there are any lawyers or past lawyers here, but some of them would light up hearing this because if the physicians were preaching something different and practicing with their patients who believed in them, and there was an adverse consequence, so they said don't get the COVID vaccine or whatever, and then their patient got COVID. Then there are patients that are suing their doctor because they gave them the wrong advice. So, you might have different thoughts about that, but I believe that, some of this stuff is actually hard to believe. Okay, God in medicine. I talked about Luke and, him being a physician that emphasized prayer. He emphasized God's healing, natural healing. Today, Big Pharma has taken the place of God, so that nobody talks about God. Prayer, when somebody gets ill, I shouldn't say nobody, I hate to use those terms, but less and less physicians talk about this. Big Pharma is now the God of medicine, so that you go to a physician, we have a drug for this. They don't talk about prayer. They don't talk about natural things. Natural healing has gone down the tube, and they make fun of it in medical literature. So, some of the things that when we talk about taking God out of medicine and doing the things that we do, we've done. For example, there's no thought to what the consequences to patients about what you're doing, what your protocols are saying. So the protocols say that every child has to be masked in school because of COVID. So what did that do to children? I think we're not going to know the immediate effects of this. I mean, we're going to see long-term effects because I think all of us know that this wasn't a good thing for children to be in school masked. So they can't communicate with their fellow students. They can't even socialize with their fellow students. This is social distance. You got to keep this distance from your fellow student. You got to eat in a confined area. Think about that. Here's a young mind experiencing this in school, no thought to what those effects of masking will be. And it's true that there are bad effects, and I think many of you have considered this already. Also, what's happened is because of this isolation, it's thought to be a major factor in suicide rate. Suicides have gone up. There is no doubt that suicide rate across the country for sure has gone up. And a lot of this is because maybe indirectly related to the fact that people are socially distanced. And, you know, the idea of getting together with their fellow man, now it's everybody's gotta be isolated. So it's led to this, it's led to, you know, suicide rate, it's led to, you know, in drug addiction. That last point I will talk about, I don't wanna bore you any longer, but is the medical community and addiction. As I said in an earlier slide, the addiction idea has gotten worse. It's gotten worse for a long time. It's been progressively getting worse. In this COVID era, the open border has skyrocketed the drug addiction rate. However, before that, doctors were doing it. The doctors were making people addicts because perhaps the big pharma was influencing them, as I said earlier, that the prescribed OxyContin for pain, and that's, you know, led to many people's death and decline rather than helping them in any way. So not only that, it's a cycle. So once they start the OxyContin in patients, the doses just keep getting more and more because the body adapts to it. So ultimately, it's not a good outcome in many cases. So I will say that the medical community has played a major role. And I think if you read back even before the border crisis happened, that the doctors were the blame was falling on the medical community. It's true to some degree that there were doctors prescribing a lot of opiates for pain control. So that is really all I have to say. Those are the points that I could summarize about this. I could probably talk for a lot longer about many of these issues, and I just will emphasize in that Hippocratic oath that physicians take on graduation from medical school, it says, you know, do the right thing for the patients. Thank you, and I'll take any questions. Yes?
I was just wondering, yesterday, we know some people down the road from us, and they say that they have medical marijuana. And, of course, they were giving it all their friends and stuff, and I just wondered, is that sort of like the opiate, is that an opioid? Is that something that is the same sort of effect?
That is in a different class totally. The quick question, yes, not an opiate. So people generally don't become addicted to marijuana. It doesn't have that property of addiction which the opiates have. So the opinions about medical marijuana are across most physicians in truth believe that this was a joke, the medical marijuana, because it was being used for things that it was never meant to be used for. Originally, they came out with it and said, this is a drug to reduce the pressure in somebody that has glaucoma, so they have high eye pressure. Marijuana will reduce that, and it will help chronic pain. But in truth, I would see in the emergency department, young people coming in at age 20s or so, showing me, we have a medical marijuana card, as if this is some kind of badge, or we're allowed to get marijuana. But this is back before it was legalized in Michigan, when it started out as a medically approved drug. So you had to have a little license. That is, the patient had to have a license that said, you can get medical marijuana. Yeah, so it really is different than opioids.
Because of the difference in the laws in Michigan and Indiana, this young man hit somebody, killed him with his truck. And because he was in Indiana and was using it, he now has to go to prison for 2 years. I just thought, wow.
Well,
Must have some effect.
I'm not supporting it, because I think it does have that effect, but on the other hand, it's impossible to control now, because of it's become legal.
What is the difference between medical protocol and medical party affiliation, or whatever you said it was?
Yeah. Party line.
The party line. Is that the same thing?
It can be the same thing. So, I don't know if this matters, but Protocols are prescribed treatments, so that, let's go for a simple one. So there's something, a protocol that, for treatment of pneumonia. So the physicians, and this protocol perhaps is sponsored by many people. It's sponsored by the CDC for the treatment of pneumonia. Then medical organizations, like the organization that I belong to, American College of Emergency Physicians, they say, okay, this is the treatment protocol for this. So it's just a list of things that you should do. If you don't follow that protocol, so you're a physician that does not follow the protocol and something goes wrong, then the physician's on the line in some cases, because somebody could grab him and say, doctor, you didn't follow the protocol by your hospital that they set up. So it's a prescribed treatment, but it pretty much, it shares hands with what you asked. Those
Do
two
you have
things.
to do it in order? You do this first and then you move to this treatment? and then-
Usually the protocols are very specific. So this is the first drug that you try, then you've got a second line protocol. So yes, they're very specific about treatments.
What if your patient's already at level 4 and
Yeah.
you have to start at level 1? Does that ever happen?
Yeah, no, usually by that time, something bad has occurred. So if you've got somebody, let's stick with a simple thing like pneumonia. So you have somebody with pneumonia and you've gone through the first protocol of drugs, then the second protocol. By the time you reach much more, there's not much anybody can do. Any, yes?
Do you have any opinions on the APA's guidelines for the with men and boys that they released recently?
Say it again.
Do you have any opinions on the APA's guidelines for male and boys about their masculinity?
Well, I don't know that specific,
Okay.
that specific site, so I can't tell you that. I don't know, but what I've seen out there is more or less like passive encouragement about changing sex if you think you might be a different sex.
Oh yeah, but I'm more concerned about the guidelines for how we're treating masculinity in guys and how it's being treated as a bad thing.
Oh, okay.
It's more of a psychological and less of a medical thing.
Yeah, I see what you mean.
Is that the
Yeah,
American Psychological Association?
I believe so.
yeah, that would be the APA. Yeah, yeah. I can't speak to that. I don't
All right.
really know that part, but
Good.
I'll pass on that, Alex. Sorry.
All right.
Comment or question for Doc here?
I just wanted to say, as far as medical marijuana, I thought it was kind of a joke myself when first, I was like, I'm not try anything to smoke, but I was on all kinds of pharmaceuticals through the VA. I was still on a couple, but I was on Oxycontin, I was on all that stuff. I was on fentanyl, and not Chinese fentanyl through the VA, but still it's fentanyl. And now I'm off all that, but I do consume cannabis. But cannabis is more of a mental addiction than wanting to kill yourself because you don't have any Oxycontin addiction. So it's totally different, and it's way lesser to in my, but I feel much better. So it worked for me.
Well, congratulations. Congratulations. That's great. Yes.
So you say that marijuana isn't necessarily addictive?
Right. It's not physically addicting.
Not physically?
Not physically addicting, correct. And it's, in other words, it doesn't cause the chemical reactions in the body that an addictive drug would. That's just a simple way of putting it. Like an opiate, because they're the classic, they're the big thing, and fentanyl is an opiate. And so those are things that actually produce the body wants more. So you get on the drug, body craves more, gets used to the drug, and it wants more.
So it's more of a mental addiction then? I mean, because people.
Yeah, marijuana is.
Yeah, there's an addiction.
And so if I remember correctly, the opioids affect the dopamine receptors.
Correct.
And that's the big difference.
Yeah. So that's Alex is talking about the chemical receptors in the body, in the brain. So, that one, the opiates do, affect that system. the marijuana, no. Oh, yes.
Just one thing about the medical profession, just kind of blows my mind. I went in to see my doctor a few years ago for stomach problems, was diagnosed with Crohn's, autoimmune disease, wanted to put me on Humira. That was kind of the same time Corona was coming out and everything. So being put on Humira would have allowed me to keep on taking in the foods that were hurting me, and it would have weakened my immune system at the same time. So my overall health would have continually gone downhill had I followed my doctor's guidelines. My wife found this maker's diet, that the foods are a whole lot better. My Crohn's symptoms are basically gone, and my body is healing itself because I'm not taking in what was hurting it in the first place, but no doctor hardly would have helped me get there.
Well, you're illustrating, I mean, I'm glad this has worked out, but you're illustrating a couple points. One is we've gone away from natural cures and natural, things, and you're, that's perfect. The other thing is the fact that you educated yourself, and that is what I emphasize to all of you. Educate yourself. Don't necessarily take one person's word, and that's what you do. You educated yourself about the adverse effects of what the doctor would prescribe. So congratulations on that. Sounds like a good story.
That mainly my wife.
Parting shot, final comment or question? Opening a can of worms here this morning. We're going to talk about technology next week. The power of technology is imposing over the world. It's making a huge impact, and it's replacing governmental agencies. And there is a move within technology, it's called technocracy. I happen to believe that the philosophy is right or true. I'll suggest it. We'll wrestle with it next week, especially as our lives are being routinely, daily, more and more influenced by technology. So, Doc, thanks for sharing with us this morning. Good to have you with us.